So, hi everyone, this is me, Nurse Rad, and welcome again to another episode here on Nurse Raddy. Now, let's talk about the nursing care plan. Now, actually, what you're seeing right now is a PDF file, fill format. So, it's so easy. There's already a fill box that I created already. So, all you have to do is just simply click this one, and then you can type your name here. And then, of course, for subjectives, you can just simply type the what the patient's gonna say. So, rest assured that it's gonna be within the box. So this is the PDF format. Now, let's go directly to the tutorial. So let's move out for this blank format. So let's look at the NCP. Now remember, when you're gonna make an NCP, usually it's gonna be like three. So we have like the airway, breathing, and circulation. That's gonna be followed strictly. So let's go for the NCP template. So here's an example. I put the name of the student, the name of the patient. I'm going to put their patient X and attending physician. It's going to be Tom Cruise, the doctor. And of course, our clinical instructor here is going to be Sir Lincoln Sumilo. And of course, then the designated title and the date. We're going to place it here. And the hospital room, MW102. That means male ward 102. Let's talk first about the assessment. So when we talk about subjective, it's going to be directly from the patient statement. So here it says, masakit ang dibdib ko kapag humihinga ng malalim. So open quotation there. That's it. Enough. You don't need to put your own observation under the subjective. So under the assessment, it's going to be objective. So this is what you're going to observe to the patient. So guarding the breathing noted, shallow respirations, RR with 24 cycle per minute, slight use of accessory muscles, clear but diminished breath sounds, and on auscultation. So that is the objective. We can, if you like to put in there the pain scale, well, you could actually place it there. Now we also have then our first priority is gonna be ineffective airway clearance related to guarded respirations secondary to chest pain. So once you're gonna refer this one to approved NANDA. So you go back to your book for NANDA. Excuse me. And next is gonna be the planning. So we're gonna have the short-term plan and the long-term plan. So for the long term, it's gonna be within your shift. So at the end of 8 hours, if you like, it can be 3 hours. So at the end of 8 hours, the patient will maintain the patient airway as evidenced by effective breathing and clear breath sounds. So we also have the long term, which is at the end of 3 days, the patient will demonstrate effective airway clearance without respiratory distress. So, yes, ayaw na ninyo pa kapina og mga 30 days, 1 week, 3 days, just like within your shift lang yun. I mean, kung when ka magbalik sa mong duty diya. So if you're gonna put there 2 days, well, you could put there 2 days. So it's a long-term plan anyway. So we're gonna go to the interventions. So anything you do, especially for your 8 hours, for example, here independent. This is independent is what the nurse can do. So assess airway patency and breath sounds every shift. Encourage controlled deep breathing as tolerated. Position the patients on semi-fowlers to promote airway expansion and monitor the respiratory rate. Let me just correct this one because hindi siya masyado naka-bullet. Sorry about that. So there you go. We have corrected ourselves already. There you go. So yan. So for the independent. Dependent is something what a physician can do. So administer, prescribe analgesics to reduce pain. Administer, prescribe. So you coin there, prescribe. So galing sa physician. And of course, to allow effective breathing and administer oxygen therapy as ordered. So as ordered by the physician. So that is under dependent. Interdependent is we collaborate. So with some other departments, such as collaborate with the respiratory therapist for breathing exercises, coordinate with the physician for further diagnostic evaluation if airway is compromised and worsened. So there you go. Now, let's talk about the evaluation short term. So we're gonna assess after 8 hours, patient maintain a patent airway with improved breathing sounds and decreased guarding. Now, here's a thing about here. So this is already wrong if I'm gonna be the one to evaluate this one because I'm gonna check first your objective. So what's your objective? So there's a shallow respiration, and I am seeing an objective here to 24. So what I'm gonna do is, before I'm gonna place something here, I would like to put an objective information such as from 24 it's gonna be 18 or 20. There you go. 18 CPM. And then I can put here goal met. Okay. Now, for the long term, after 3 days, patient demonstrated effective airway clearance without the signs of obstruction. So going back here, so guarded breathing sound. So I'm gonna use an objective data here, and there you go. Sorry about this one. I could just place there RR. There you go, and RR 24. So I'm gonna put here 18, and then cycles per minute. Then I'm gonna tag this goal met. There you go. I can put it at the bottom. Okay. So there you go. I am done with my first priority, and let's move on. So my second priority, let me just show you my second priority here. So my second priority is impaired breathing pattern related to chest pain, secondary to pleural irritation. The third priority, let me just open this up. So my third priority is acute pain related to inflammation for pleural structures. So if you look here in the objective, we're gonna be talking about pain. So what's wrong about this? So if I'm gonna be talking about pain, then I should be indicating here some, what do you call this, pain scale. So pain scale. For example, if the patient said a pain scale of 7, then I go to the evaluation. It says here patient reported decreased pain with improved discomfort. Then I should indicate the pain scale. I'm gonna put the pain scale here on the evaluation, and if there's an improvement. So if I'm gonna put here like the pain scale of 5, then did I meet the goal? Absolutely, goal met. Okay. Same thing here. Pain free without discomfort. Match it with your objective. Then I will place here pain scale goal met. Okay. So if the pain scale is more than 7, since we have here the pain scale of the objective of pain scale of 7, and you put here 8, then the goal is not met if it is more than 7. Okay, so there you go. That's easy how to make a nursing care plan. So anyway, that's it for tonight. Thank you for watching. This is me, Nurse Ratty, on Nurse Ratty. Nurse Ratty, the radical nurse.